You know, honey, I'm really nervous about this.
It's okay, Julie. We'll get through this. Come on.
Today is a crossroad in the life of Julie Davis. She was recently diagnosed with breast cancer, and soon she'll take a significant step toward her full recovery. Later this morning, an oncology nurse will infuse life-saving chemotherapy into her bloodstream. It's a scary proposition for anyone, and her mind is more than likely whirring with questions and concerns. But what she'll probably never realize is all the work that went into having that critical mix of compounds ready for her as she walks into the treatment center. With all her apprehension about this treatment, there's no doubt Julie would be comforted to know that a team of dedicated professionals from Oncology Plus are on her side and fully committed to her recovery. Simply put, Oncology Plus is the best possible alternative to operating an expensive in-house pharmacy. As any practice administrator can tell you, mixing chemotherapy is a very costly expense and it's not reimbursable. By allowing Oncology Plus to mix your chemotherapy, your staff can focus on patient management and other more profitable areas of your practice.
Another practice in our city introduced me to Oncology Plus. At the time we were struggling with staffing and felt like we needed someone to be that second look at our calculations and our preparation of chemo. They were also able to provide some of our drugs at a very competitive rate, and we just loved the fact that they could deliver everything we needed the next day.
The nurses love OPI because a couple years ago there was a lot more of the drugs that we get that we had to mix, and so we looked at compatibility and time frame that it could be mixed and get here if it was mixed the night before. So it cut down on the amount of time that we are under the hood, which, like I said, then we can spend that time with the patient and not be away from the patient.
Clark & Daughtry is a multi-specialty physician practice. We have over 50 plus physicians. If Clark & Daughtry doesn't turn a profit, then my job becomes very insignificant. And so one of the main purposes of course Clark & Daughtry being a medical group, or our private medical group, our survival is based on our ability to be a profitable organization. Well, one of the biggest pieces of OPI's interaction with Clark & Daughtry has been helping us in managing that inventory. The orders go to OPI. OPI mixes the chemo products, and the products are ordered on basically a real-time basis, delivered to and administered to the patients, and then the billing process submitted to the insurance carriers. That tightens that cash flow and that revenue cycle down tremendously. We're dealing with multi-million-dollar products, and even weeks and days that can be shortened in that time cycle can involve many thousands of dollars over the course of a year.
Oncology Plus offers your practice the safety, expertise, and peace of mind of an in-house pharmacy at a very reasonable and affordable price. Our clinical oncology pharmacists and certified technicians are available when you need them to answer your questions and address your concerns. And like an in-house pharmacy, your chemotherapy is mixed as you need it. This cuts down considerably on waste. With our just-in-time delivery system, there's no inventory carrying cost and no wasted products sitting on the shelves. We also dramatically reduce your need for hazardous materials disposal, as well as the need to maintain an inventory of mixing supplies or the upkeep of an expensive sterile environment.
OPI makes my job easier because the drugs come mixed in a bag. All we have to do is take it out of the bag and administer to the patient. There's rarely any mixing involved. And then there's always a pharmacist at hand to ask questions for clinical issues, which is very helpful. It helps our nurses use our time more efficiently.
As reimbursement from insurance companies have decreased, I've had to depend on Oncology Plus more. And that is in the way of providing that mixing and preparation for our patients. It helps a lot with making sure that I'm billing for everything that I'm using for each patient. the information that they're able to provide me on a monthly basis for accountability for what I bill out as compared to what I'm purchasing has been extremely helpful. The great thing about Oncology Plus is for every patient that they're delivering product for that day, the patient's package includes a packing slip, and it's detailed with everything that is included. This helps us tremendously in billing for that day.
It would cost more if we didn't have somebody to help us in that aspect that OPI does. Having OPI mix our drugs for us does save us the money of the wasted drug because they're mixing it there. Some of the doses are single-dose vials, then other doses are multi-dose vials. If we were mixing it here in clinic, we might not be able to use that multi-dose vial to the fullest of the benefit of the drug. So there would be some waste.
Chemotherapy nurses are some of the most expensive support staff in a medical practice, and having the mixing and the services that are provided by OPI done off-site helps us then have that staff focus on the administration of those chemo products and in their interaction with both patients and physicians in a more effective manner. You now have multiple components in the verification process. Oncology Plus verifying what the doctors are ordering, as well as our own staff double checking that, and then at the time of administration of those oncology products, they're being checked again.
Your staff and patients can feel confident that they're receiving the finest state-of-the-art pharmaceutical infusion care currently possible. Our pharmacists can provide accurate and dependable answers on infusion rates, dose adjustments, compatibility, and product stability. We can also assist you with researching and in-servicing new chemotherapy agents and protocols. Additionally, Oncology Plus can significantly reduce practice costs associated with hazmat disposal, mixing supplies, and the high cost of sterile environment upkeep. You won't need to worry about it, because we do. OPI's facilities exceed the standards set forth by Chapter 797 of the U.S. Pharmacopoeia, as well as all state regulations. All of OPI's delivered products are prepared in a closed, environmentally certified clean room complex. Our pharmacists and certified technicians use strict aseptic technique to ensure medication sterility and safety for every patient. Another benefit of using OPI is increased safety for your staff.
The benefits of using OPI, in my opinion, are the decreased exposure for the nurses to chemotherapeutic agents is a big benefit in terms of safety.
Partnering with Oncology Plus is a great way to increase the productivity of your practice while advancing the care for your patients and the safety of your staff. All that at an overall cost savings as well. What's not to like? But don't just take our word for it. Listen to what our customers have to say.
It would cost more if we didn't have somebody to help us in that aspect that OPI does. I would highly recommend OPI to anyone.
Based on the experience that we've had, all the way from the pilot study to present day, where now we are 100% utilizing OPI services for all of our chemotherapy regimens and mixing, we feel that this is the only way to go, and that it would behoove any other organization to follow the same format. The cost savings, the improved quality, the reduced liability, the increased nursing time with the patients, all of these factors are positives for this program. In fact, there are almost no negatives to the program.
I would definitely recommend OPI for many reasons, but the main ones are the safety issues for the nurses as well as the time management benefits.
Our relationship with Oncology Plus has really developed over the years. It's one of those relationships like your best friend, in that you know they're going to be there even though you don't talk to them every day. That's the type of relationship that I have with Oncology Plus. I know that I can trust them, and we work great together as a team. And I do recommend them to other practices around the state and in our city. And I don't have any reservation about doing that.